Hello friends, today we are going to talk about another important topic that is known as the fatty liver disease or the FLD. Fatty liver disease has been classified into two types basically. One is the alcoholic fatty liver disease and the second one is non-alcoholic fatty liver disease. These days we see that the non-alcoholic fatty liver disease is on the rise and people have started recognizing the disease or the syndrome, and it is associated with mostly an increase in the non-utilization of fats by the liver, in which there is accumulation, there is steatosis, that is the accumulation of fat in the liver cells, and they are not able to metabolize the liver and take it out of the body. Hence, there is a rise in the fatty depositions in the liver cells. And when this happens, the liver is unable to function properly, and therefore when we investigate and do the blood tests, we find that the enzymes of the liver show an increase, and then we come to know that the person is not able to metabolize the amount of fat that they are consuming, and something is to be done in order to check the liver from getting converted into fatty liver. The fatty liver is of various grades depending upon the amount of fat that gets deposited within the liver cells and the ratio of fat to the liver cells that classifies the category of fatty liver. Usually we see that these diseases, that is the fatty liver syndromes, are more prevalent in people who are suffering from obesity, and there is an increase in the level of lipids, that is the triglycerides, and the patient may become hypertensive, and there can be hypothyroidism associated with the disorder. When we analyze the body parameters, it is seen that the waist size of such patients, it shows a marked increase than the normal, and the fat is basically deposited around the waist of that is the area which is more prone to deposition of fat when consumed in excess. There is an marked increase in the visceral fat in such patients, and therefore it is recommended that once you have an increase in your body weight, or there is a metabolic syndrome where the triglyceride levels may become high and there is obesity, deposition of fat around the waist, one must go for an ultrasonography to find out if fatty liver is being developed in the body. The disease is not curable but can be controlled, and control will be because of lifestyle changes. That is, the person will have to consume less amount of fat, will have to work out to decrease the body fat ratio, and the BMR should rise. If there is any variation in the thyroid levels, it has to be controlled. And in people who are suffering from the alcoholic type of fatty liver disease, they have to stop the consumption of alcohol, since the liver cells are unable to metabolize the amount of alcohol that they are consuming, and resulting in steatosis, that is the deposition of fat within the liver cells, and disturbance of morphology as well as the physiology of the liver. Hence, I would recommend that when you go for a complete body checkup, it is very necessary, especially if you are middle-aged, suffering from a little bit of obesity and having fat deposition around your waist, go for a liver function test which tells you about the enzymes. And even if the liver function tests are within the normal limits, one should go for an ultrasound to find out if there is any type of fatty liver developing, since it can be controlled in the early stages. These days, more upgraded tests like fibroscans have come into picture, which can also tell you the amount of fat that is present within your liver. It is better to control the disease than and stop it from developing into a much worse situation in which it can go into liver failure or sometimes into development of liver carcinoma, and thus it can become cause a lot of morbidity and mortality in patients. Early diagnosis of a fatty liver is very essential to control the disease and hence stop the further changes that might occur if not stopped. Thank you so much.